I'm Dr. Stephen Goldstein, a professor of obstetrics and gynecology at NYU School of Medicine here at the NYU Langone Medical Center in New York City. This is another segment in our series, Reducing the Confusion in Gynecology. And what I want to talk about now is if you've been told to have a biopsy, don't. You know, blind endometrial biopsies through these little tiny plastic devices became very popular in the early 1990s. Before that, women had a formal D&C. D&C stands for dilatation and curettage. What some women call a scraping was done under anesthesia. So these biopsies became very popular. There was one study that suggested they were accurate 97.5% of the time. And so this was highly publicized and became the standard of care. In 1995, a much better study showed that in women with known cancer who had a biopsy in the operating room before their hysterectomy, they missed 11 out of 65 of those cancers. That's 16% of the time a woman with cancer had a biopsy, it was missed. But they cut open those uteri and found that in every one of those cases, the cancer occupied less than half of the surface area of the uterine cavity. I've lectured on this since that time in 1995, yet it took until 2012 for the American College of Obstetricians and Gynecologists to finally put in their practice bulletin guidelines the fact that a blind endometrial biopsy, when positive, is significant, but when negative is not a stopping point. And it's very discouraging that I think still the majority of practicing gynecologists don't know that. They still do a biopsy as their first choice. Now, it really is okay to do that biopsy, but they don't realize that unless it shows cancer or very advanced precancer, it is not a stopping point. Studies have shown that these blind biopsies occupy approximately 4% of the surface area of the uterine cavity. So unless the process that's abnormal is global, you're very well likely to miss the abnormality with a blind biopsy. Instead, a saline infusion sonohysterogram, where they put some fluid into the uterus with a tiny catheter to distend it and see better. I mean, think about it. The reason ultrasound's such a home run in obstetrics is the baby's in a bag of water. That's why we see so well. So by putting a little fluid into the uterus, you can see better. Either that or some of these newer disposable office hysteroscopes, where we can actually see inside the uterus in a matter of minutes, very painlessly. This is what the standard of care has become, but unfortunately, too few gynecologists are practicing it. So if you or a friend or a colleague or a sister are told you need a uterine biopsy, ask first, are you going to do a saline infusion sonogram? Are you going to do a disposable hysteroscopy? Because a blind biopsy is no longer the standard of care.